Adverse childhood experiences, called ACEs, are traumatic events in a child's life before age 18 that are so significant they can cause toxic stress and lifelong negative health outcomes. They include events such as witnessing domestic violence, experiencing physical, verbal, or sexual abuse, the separation or divorce of parents, and living with someone in the household who had an untreated mental illness, abused alcohol or drugs, or was incarcerated. These experiences have ripple effects well into adulthood, negatively affecting earnings, education, and health. Childhood adversities in California are widespread. According to the latest survey data, 2/3 of California adults experienced at least one of these adversities in their childhood. 1 in 6, more than 5 million adults, have experienced 4 or more adversities. Even one type of adversity can be traumatic, and each additional type magnifies the potential impact, making ACEs a significant public health problem. Adults with 4 or more adversities have increased odds of chronic health conditions, depression, and heavy drinking compared with those who have no adversities. So reducing and preventing ACEs can improve health and well-being. While adverse childhood experiences are common and occur in every community, some groups experience more adversities. Decision makers, public health professionals, and child and family service providers should be aware that nearly twice as many California adults who are lesbian, gay, and bisexual reported 4 or more adversities compared with those who identified as heterosexual. More than 1 in 5 adults in households with incomes below $25,000 reported 4 or more adversities. More than 1 in 5 adults enrolled in Medi-Cal had 4 or more adversities. Because adults with 4 or more adverse experiences in their childhood have higher odds of alcohol or drug misuse, chronic health conditions, depression, and suicide, children living with those adults are also at increased risk. More than 770,000 households in California have children who live with adults who experienced 4 or more adversities. What can we do to help these children and adults lead healthier lives? Get involved. California's communities are hard at work to change conditions that lead to childhood adversity. Join a local coalition to be part of the effort. A local list of coalitions can be found on the adversity page on kidsdata.org. Support protective factors like increasing social connectedness within the community, improving school readiness, neighborhood safety, and play areas for children, and reducing poverty. To help reduce poverty, encourage California's families to access child tax credits and paid family leave benefits. Help break the cycle with actions such as supporting efforts to reduce stigma around seeking help with parenting challenges, substance misuse, depression, and suicidal ideation. Improve monitoring at both the individual and community levels, such as clinical screening for adversities and expanding surveys. Adverse childhood experiences may be common, but we can help ensure their effects don't follow people into adulthood, and we can reduce and even prevent harm for the next generation.